PPEs for the people handling treatment of the fast-spreading virus.
As we speak, nationally, we have over 70 doctors, public and private, who have been infected with this condition. If we want to maintain the health worker force, we must prioritize the testing of health workers as well as hospital-based samples.
We have details as the Ghana Medical Association calls for immediate prioritization of testing of those on the front line. Also tonight, minority calls for a total shutdown of Parliament after the majority leader revealed some MP staff and members of the press corps who tested positive for the virus are defying the directive to stay home.
Who is he reporting to? Who is he complaining to? What has he done about the problem? I believe that we are not safe and that Parliament must be closed down. I thank your own colleagues.
Top stories brought to you by Bond Savings and Loans. Your success, our passion. Gasem, the nation builder. Vodafone, the future is exciting. Ready? My name is Ernest Manu. Now, Ghana's COVID-19 cases stands at almost 11,000 today, a significant jump from 10,358 to 10,856, with 48 deaths and 3,921 recoveries. As our cases continue to soar, there's trouble on the front line as well. Tonight are over 70 doctors in both private and public practice in Ghana have been infected with COVID-19. Now, as if that is not enough, hundreds of our health workers in the various facilities across the country have also been infected, with several others asked to go into self-isolation, causing a further strain on the healthcare delivery system in the country. In the central and eastern regions, 2 health workers have died. In the Mfantsipim municipality, where 24 cases were detected, the health directorate says the situation has hugely affected the staff strength, as many of the exposed staff must go into self-isolation. Richard Kojunyako has more in the following report.
The 24 health staff who have tested positive for the virus is out of the 72 recorded cases in the municipality as of June 9, 2020. Deputy Director of Nursing Services at the Sopon Government Hospital, Theresa Nana Youngson, gives details of recorded cases, recoveries, and deaths.
Mr. 3 of them have been on treatment, out of which 36 have recovered and start going in discharge, giving us recovery rate 57.1%. 1 death has been recorded in the municipality. 24 health workers have been infected with the disease in their line of duty. We pray for all affected individuals and wish them speedy recovery.
She laments the infected workers and their contact at the hospital, some of whom are also health staff, had been quarantined, and this has had a further toll on the staff strength.
Yes, in case a staff gets infected, all the units, the staff around that particular staff, will be quarantined, and in effect affect the clients or the patients. So it really affect the staff strength. We will try and use some reshuffling. We pick some of the nurses and go to that to help. That's what we have been doing, even though it's still not the best.
Theresa Youngson says it's obvious that inadequate PPEs were a hindrance to the fight against the coronavirus and appealed for public support.
As all of you might have been aware, the inadequacy of PPE and the important logistics like non-contact infrared thermometer, liquid soap, tissue paper, etc. have been a major hindrances facing us in the fight. Government has done a part by giving some of these items, but because they are mostly disposable, there will never be adequate, and hence the need for frequent supply of these items.
The Pacific Oil Company Limited donated PPEs to the hospital valued at 30,000 Ghana cedis. Richard Kwejenyako, Joy News, Cape Coast.
Now, the Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bayo, whilst calling for the prioritization of testing of health workers, is also expressing concern about the worrying trend. He spoke on the Midday News.
Indeed, this concern has come to us, And we have also collated even data on our own. And I can state that as we speak, nationally, we have over 70 doctors, public and private, who have been infected with this condition. A lot of them have recovered. Fortunately, most of them were asymptomatic, but some did have symptoms. Some went into treatment and have been discharged. So it's of serious concern to us. The root cause of this, or what we can do to minimize this, is our testing. And we have made this point over and over again. If we want to make sure that we maintain the health worker force to be able to render service, we must prioritize the testing of health workers as well as hospital-based samples. This is the only way to minimize the number of health workers who are taken out of the system. And it is not difficult to understand. If you have a sample of a health worker taken and it takes you 6 days, 7 days to get the report, while the person is still working with colleagues, by the time this thing comes, the report comes, if it's positive, you can imagine the number of people who have to self-isolate. If you have an inpatient that you suspect, and then you take the sample, and it takes that long for the reports to come back, again, you can just imagine, for one shift, you have 3 nurses.
But what is the difficulty? I'm sure you've been finding out. What's the difficulty and why these delays?
I honestly cannot explain. Initially, we thought because of the enhanced surveillance, the testing centers were jammed with samples. At some point, we heard that they had cleared all the backlog. One would expect that then we are going to begin having results coming in speedily. That hasn't been the case. We asked for prioritization of samples of healthcare workers and inpatients. They should be labeled differently, assigned barcodes that will go and will get the results quickly to take decisions. They started a barcode system, but it has not improved the system. The barcode system they are using it now for almost every other sample. So we don't know whether they have a distinguished barcode for health workers and hospital-based samples. Because these are the 2 critical things that is fueling this. Because if the patient is on the ward and it takes us a week, 2 weeks to make a diagnosis, by the time that diagnosis is made, almost every health worker in that unit is exposed, unless you are on leave. Because the cleaners are there, 3 nursing shifts per day, doctors are coming and going, physiotherapists are coming to work on the person. So all these people become exposed. Meanwhile, if you got that sample in a day, the reports come in 2 days. At most, even if you have different nurses running a shift, you are going to have 6 nurses on that person. So the point cannot be overemphasized.
So that's the Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bay. A very worrying situation there. Let's go into the phone lines now and speak to the General Secretary of the Ghana Registered Nurses and Midwifery Association, David Tinkran Chum. Joins us on the line. Mr. Chum, thank you very much for your time here on Top Story. Let's talk about the infection among your members. What do the figures look like?
Good evening, my brother, and good evening to your listeners. Indeed, the figures keeps rising. We are not surprised because people are not listening to us. As we speak, we have about 168 nurses and midwives being infected.
168 nurses and midwives?
Yeah.
In both private and public, or this is just the public sector?
Both private and public. And this is as of 3rd of June. I'm yet to be updated.
This is as of when?
3rd of June.
The 3rd of June.
Is that 3rd of June? 3rd of June.
Okay.
But so I'm yet to be updated as far as the current statistics are concerned.
So it's very possible that the figures might even go up when you get the latest update.
Absolutely.
What, in your opinion, is accounting for this?
Well, let me say good evening to my brother, Titus Bayu, Dr. Titus Bayu. Indeed, the account he has given is not different from what we also have. Now, the trajectory of the disease condition is changing. And as you may recall, we used to do effective contact tracing and the rest of it. And now, what we have observed that people are reporting to the hospitals with the disease. If you like, they come either asymptomatically or symptomatically. Because we don't have on-the-spot diagnosis, they will be admitted onto the ward. And I'm telling you that unless we change the narratives or the way we manage the patient, we are going to have a lot of nurses and doctors and other supporting staff getting infected. Because the people are admitted on the ward as an ordinary case, by the time you could say Jack, it turns COVID. Right? So I think we need to review the whole concept of management, where we have to have an isolation area for maybe suspected cases. So when you test positive, then you are transferred to the treatment centers. So if we are not careful when we admit cases to ordinary wards, then everybody becomes infected. All right. As I speak with you, the last time I spoke to your patient, I appealed to the Director General to at least help so that nurses and midwives who are pregnant will stop coming to work. They did not heed to this a call. And as I speak with you, I know a pregnant lady. She is 34 weeks pregnant, infected with the virus. All right? The husband is a nurse in OT region. I don't want to mention the name of the hospital. I don't want to mention the name of the nurse. But
was it not possible for these workers to take leave? Is there a ban on the taking of leave or a freeze on that?
I mean, why should I proceed on leave? Because, what I'm saying is that we need to prevent them from getting infected. Mm-hmm. And if we clearly know that they are susceptible, why do we not ask them to stay away from work? Okay? So these are some of the things that we are asking for. There are more nurses and midwives out there. I mean, we have several badges that have not been employed. We have 2018, 2019 diploma nurses, NAC and NAP nurses, degree nurses who are at home. Let's employ these people to augment the fee, so that at least those who have served all these years and by the grace of God, perhaps they are pregnant, can be relieved of their duties for now. Our people are getting infected. And more so, you can't imagine if a pregnant woman gets infected with the virus. So these are the challenges that we have. And as the Director General must listen to some of these concerns that we have expressed.
Do you have any deaths?
We have one death now.
One? Where?
Oh, that is what happened the last time. I mean, Eastern region, we experienced one death, but it's not a nurse. It's a health worker though, but my checks this morning shows that she's not a nurse or a midwife. She's a health worker though, but she's not a nurse or a midwife.
So you stress
now, the death of nurses stands at one, as you know. Now
you stress on the handling of suspected cases, but when we spoke to Dr. Bayo, he also talked about the prioritization of testing for health workers who are exposed. What is the situation in your case? Does it take very long for the results to be delivered, just like we've seen in the case of the doctors?
It takes a long time. It's not different. We are working in the same vicinity. So whatever applies to doctors applies to nurses and midwives. It's the same challenge that we have. You get? So, I mean, when you are exposed to the virus, I mean, they test you. They ask you to self-isolate or quarantine. And then after 7 days, they repeat the test. It takes a long time for the results to come, not only for health workers, but even the patients. You get a point. That is why he indicated that you might have nurses running several shifts, okay, in turn. And by the time you realize, all these people might have been exposed. Okay, so these are the challenges. What we are asking our nurse managers to do is to perhaps change the shift system. Instead of running 3 shift systems, we can do a bi-shift system so that the rate of exposure can be minimized.
So you mentioned the handling of the suspected cases, a review of the shift system. I'm just wondering, the last time we spoke to you, you raised concerns about the quality of face masks that were being distributed to your members. Do you have enough protective gear for nurses across the country?
I mean, it goes without saying that problem still persists. I mean, we were told that Food and Drug Board have certified a cloth mask. Scientifically, it is inappropriate to use cloth mask in clinical settings. We don't want to believe at this point. I don't see why people cannot reason up with us. There is no way you can use face mask as a clinician. It can be used on the street. It can be used anywhere. Of course, maybe at the beginning of the test, it could have the same efficacy as N95 based on whatever layers you have, 3 layers, sandwiched with a tip or something. But what about if it is used or it is reused? Okay? It is not a time to use usable face masks as far as clinicians are concerned. They are getting infected. Instead of getting disposable masks, N95 and the rest of it, somebody says that clinicians should use face masks. It's something that, I can't even run my mind around it.
I want to thank you for your time here on Top Story. That's the General Secretary of the Ghana Registered Nurses and Midwives Association, that's David Tinkranchum, speaking to us there on the situation we have among nurses across the country. Over 168 nurses have been infected. They are positive for COVID-19. For the doctors, we know that 70 of them are positive. There are a few who have died, 2 in the eastern region and also in the central region. And 1 nurse has also passed away as a result of COVID-19. Now, in the Ashanti region, something interesting is happening. Whilst it seems like there's a challenge at the front line as far as the health workers are concerned, we have contact tracers also raising issues with remuneration and allowances. They have been on a strike in the Ashanti region for 10 days now because they claim that their allowances have been slashed by 50%. We'll go onto the phone lines now and speak to one of them. He leads them in the Ashanti region to find out exactly why this is the situation over there. But also in Parliament, there's a situation that is brewing because the possible spread of the virus is almost inevitable following the refusal of some MPs, staff and some members of the press corps who may have tested positive, who are refusing to comply with the stay-home order. Let's listen to the Majority Leader, Osei Mensah-Bonsu. When he was presenting his business statement before the House today, he raised the issue on the floor. Listen.
The issue, Mr. Speaker, is if you submitted yourself, you tested negative, as some of us have, on 2 occasions I've submitted myself, I've tested negative. That doesn't mean that I'm out of the woods. If anybody tests positive and comes close to me, chances are that I may contract the disease. And it goes for everybody. So we want to appeal to honorable members, to the staff and to journalists, who have been contacted behind the curtain and who are not submitting themselves to the testing team. We are impounding the lives of all. I think the team is getting frustrated, and we want to appeal once again to members, staff and journalists that if you are contacted, please don't come and imperil the lives of people. Yesterday, it was observed that one person who had been spoken to had gotten close to some members of parliament. He was engaging them, even though they have been spoken to. So please, let's be on the watch out for one another. We don't need to do that. So colleagues, members of parliament, staff, and journalists, please let all comply. Otherwise, perhaps the medical team then may be forced to unveil the identity of those of them. And it's not good. They don't intend to do that. But those persons know themselves and they should comply. The Speaker intends, in accord with that, to have an agreement with the team, such that those of us who are not able, members of parliament, staff, and journalists who are not able, including the security personnel with us, who are able to submit themselves, would have the last opportunity to submit themselves, so that we know that all of us are secure operating in this environment. Mr. Speaker, thank you very much.
So you have the Majority Leader, Osei Mensah-Bonsu. Parliament will from next week organize a second round of tests for members of the House for staff of the parliamentary service as well as members of the parliamentary press corps who were not able to test during the first round of tests. Now, the minority spokesperson on health, Kobna Mintakando, has reiterated calls for the leadership of parliament to immediately shut down the House for MPs to self-isolate following the admission by the majority leader that some members and staff have tested positive but are not adhering to the directive to stay home.
Master, to be frank with you, when I heard this, I was exceedingly shocked. Because if you remember, this is the same majority leader who bastardized, who vehemently disagreed with Honorable Muntaka, the minority chief whip. When the minority chief whip was saying that we should not cover up, just like all Ghanaians, if there are positive cases in parliament, the entire country must move. He was not even saying that the individual should be moved. Now, he even went ahead, the majority leader went ahead to say that even if there are members of parliament who have tested positive, they were going to be called individually, and therefore he will not get the opportunity to know who and who have tested positive. Now this same person comes back to tell us on the floor of the House that there are members of parliament who have tested positive and they are still with us on the floor of the House. He goes ahead to say that there are some stuff that he saw yesterday interacting with members of parliament who have tested positive. How did he get to know now? All of a sudden now he knows. How did he get to know? And who is he reporting to? He's the leader of the House. What has he done about that? Why can't he engage those same people? Quite apart from that, and I keep telling you people that this government keeps playing politics with our health. You know why? After the time the minority chief whip stated that we should not cover up, the CI 126 have not matured. So the majority leader was of the opinion that if it becomes waste, Parliament will shut down, and then the CI 126 will not get matured. Now he has waited until the CI 126 has matured. He is coming back to tell us that now he's privy to those who have contracted the virus. I am ashamed. And for me, the Speaker must be firm. As a matter of urgency, Parliament must be closed with immediate effect. Because if people are tested positive and they are communicated to them and they still come to Parliament, we are at a very high risk, including you, the media. He was complaining to who? He's a leader of government business. He's a minister of state. He has the president here. Who is he reporting to? Who is he complaining to? What has he done about the problem? I believe that we are not safe and that Parliament must be closed down. I thank your own colleagues.
And so that's the minority spokesperson on health, Kobna Mintakando. Let's go to the phone lines again and speak to virologist at the KCCR, Dr. Michael Osu. Thank you very much, sir, for your time here on Top Story. We seem to be seeing a fast spread of the virus. The numbers are going up quickly. Between yesterday and today, just within 24 hours, we've had over 500 cases adding on to the case count. What is happening from where you stood? What do you see happening?
Yeah, good evening to all your viewers, and good evening to you as well. I think that within the first week of June, and almost today as at 12, it looks like the daily new cases seem to be increasing compared to the previous month. As I said, the cumulative numbers should not scare us. But then the number of new cases that are added on is what is something we need to look at it closely, and we need to begin to put in some measures to contain the spread. So I think that the daily new cases going up is quite worrying, and we need to relook at where the hotspots are, see where majority of cases are coming from, and if possible, begin to restrict movement at places where these surges are occurring. I'm sure that if you look closely at the data, there are particular places where these cases are predominantly occurring, and the earlier we close those hotspots, I think that it will be very useful for all of us.
When you say restriction of movement, you're calling for some form of a lockdown?
So this is not a lockdown. I mean, lockdown is a term that mostly you want to look at the broader context of the region. But then we know the president announced that as and when surges occur, he'll move, they'll move to this hospital. Localized areas where people are transmitting and infecting themselves. Mostly this occurs in clusters. So at the regional approach, there could be clusters which could be spots where people are infecting or transmitting. So, and data on this is available through the Public Health Division and surveillance. They know where these cases are coming from. So if you restrict movement in those places, you can better contain it, and then you'll be able to manage what happens at the regional level.
There's a suggestion that the virus perhaps is mutating, which is why we're seeing such a spread and the increase in the numbers. What do you make of that suggestion?
Well, I don't think the virus is mutated. This virus, if you follow the trajectory, it follows an exponential order. This is not peculiar to Ghana. If you look through the Africa CDC dashboard, it took close to 98 days for Africa to get about 100,000 cases, but then it's taking close to about 20 days for them to get to our 200,000. So our cases is more of a chronic case. The deaths in the whole of Africa is moving up much faster than what we used to know before. So what it means is that it's possible we are getting to a point where the cases are increasing. Most of the symptomatic base has been built. So the symptomatic are beginning to knock out the people who are in their homes, who may be weak, who may be vulnerable. And it's these people who are reporting to the facilities. When we started from March 12, March 13, 14, most of the cases we had seen before, most of them were asymptomatic. It is now that, the vulnerable are beginning to have a feel, because this is moving into the community, into the households. What is the picture we are seeing now? I don't think it's mutation. If you study the mutation of the virus, the sequences, there hasn't been any significant deviation from what was seen in China and what is in Europe. And most of the sequences are deposited in Nextran, which is known in South Africa, in Congo. We know how they are looking at. It's not so much of a departure from what we know, which I don't think our case is much different. What we are seeing is because it's what is supposed to happen. It moves through a slow pace, get to the point where it becomes well established within the community. The symptomatic base is well built. And then it begins to affect the vulnerables. And this is why if you are able to restrict this asymptomatic population, who are mainly the young people, you will be able to at least reduce the spread to these vulnerable groups, which is, I think, something that we have to look at. The president announced this very earlier. That as and when there are surges, he will move in to close the hospital. So I think that if we see the data is beginning to show a pattern where particular places are, surges are occurring at those places, then I think we have to close those places down and manage the situation.
And very finally, just 30 seconds. Yesterday when we spoke, you said the testing capacity in terms of the pooling is no longer relevant because of how the cases are going up and the positive cases increasing quickly, and so we need to ramp up in terms of our testing capacity. Where are we at the moment, and how much more do we need?
Yeah, I think that it will be very helpful if the gene expert machines come in very quickly to help and to augment the testing capacity of Ghana. Because as I said yesterday, initially when the prevalence was very low, it's possible to do 30,000 tests within about 3 days, which is what Noguchi did and which is what KCR was also doing. But with the increasing prevalence of this virus, what it means is that you can no more pool samples together. You have to work on samples on individual basis, which means that a lot of us will revert to our earlier testing capacity that was announced. So what it means, you need more PCR setups, what is the gene experts and other machines to quickly come on board. So we'll be able to test as many as
possible. Thank you very much. Dr. Michael Owusu is with the KCCR in Kumasi, and that is for Top Story, brought to you by Bond Savings and Loans. Your success, our passion. Vodafone, the future is exciting, ready, and Gassam, the nation builder. I'm Ernest Manu. Up next is Ghana Connect with Daniel Dazi. Daniel, what are we connecting on today?
We're going back to school, Ernest, on Ghana Connect, because we need to have this critical conversation about the preparations that have been made by the relevant authorities and how students feel about going back to school. Universities are reopening on Monday, and the second cycle and the basic institutions will open a week after that. So we have students coming on Ghana Connect tonight to share their perspectives.